Everyone. Hi, my name is Deborah Becker. I work for WBUR here in Boston, and I'm really excited about this panel. We'll be talking about what the nonprofit world is doing in this space, and we have some great panelists in both sessions. And we also have some folks here who are recipients of medically tailored meals who will talk about their experience as well. So we think we're bringing you a great picture, but we have a very short amount of time. I have a big clock in front of me warning me not to talk too much. So we'll get right to the discussion. So first, I'd like to introduce you to David Waters, who is CEO of Community Servings. And I'm going to start by, because I'm not sure everyone's familiar with what nonprofits are doing in Boston, just a brief overview of your work and how you're addressing this issue.
Thank you, Deborah. And thanks to Tufts and Food Tank. We're so excited to be here, and we are a proud research partner with Tufts as well. So I'm David Waters. I'm the CEO of Community Servings. If you don't know what we do, we are primarily a medically tailored meal provider, but we also do a lot of research and policy work at the state and national level. We do a food service job training program, a large local foods program, but really focused on the topics today around food as medicine. This year, we will provide 1.2 million medically tailored meals, all of which are scratch-made and tailored in multiple ways to fit the needs of our patients. And one of the stats I really love is that we will deliver to people in over 300 towns and cities in Massachusetts and Rhode Island this year. So really, probably the widest reach of any food insecurity program in the region. But in addition to that, we have done some really significant research around the ROI on medically tailored meals. So if you're not deep into this, like some of us are, we published in the Journal of the American Medical Association research on people that we had fed, and we discovered that we saved 16% on their healthcare costs net of the cost of meals, a 49% drop in hospitalization, 72% drop in referrals to skilled nursing. So that is really the building block, the foundation on which a lot of the work of food as medicine is done, in that we can prove that it works. We can demonstrate to healthcare that this is a smart investment, and to the government, although the CBO doesn't always agree with us. And more recently, we have 3 large NIH R01 studies going. 2 are randomized control studies, and the third is a partnership with the Friedman School and UMass Medical School, looking across 9 different hospital systems at the provision of medically tailored meals. It will be the largest study of medically tailored meals in the country to date. With that data, we now have 22 healthcare contracts. So we are, through the 1115 waiver and other vehicles, we are one of the largest in the country probably for the number of healthcare contracts that we have. And then I just want to do a quick plug. The 2 newest programs that we launched this spring, one is a program for pediatric patients, developing diets specifically for pediatric illnesses, and similarly for high-risk pregnancies and pregnant people. I just get so excited about thinking of how we can use food in so many different healthcare settings.
Thank you. Thank you. Thea James, she's with Mission at Boston Medical Center. And would you tell us all a little bit about some of your work? We heard some from Nubian Markets, some of your collaboration with Nubian Markets in the for-profit panel that preceded us. But I'm wondering if you could tell us a little bit about what you do.
Sure. So I'm at Boston Medical Center Health System, which, as many of you know, it is, it fits under the category of one of America's essential hospitals, which used to be called safety net hospitals. And what that that means in one's mind that poverty. When you think about the patients who come there, and I think one of the things we know that is a root cause of poverty is not having access to economic inclusion. And so we are not unlike, most well-meaning people. When people don't have things, we always want to fill the gaps and provide them with what they don't have. But I think one of the things that we have done and really try to hold ourselves accountable for is to do a bit of interrogation to really understand why people don't have things. You know, what most people do, and I think, again, this is what well-meaning people do, they would look for more opportunities to provide more people to have access to food when they're food insecure. But we have interrogated this situation to understand why they don't have it. We want to go to the root cause. And again, the root cause is economic exclusion. And so a lot of the things that we do are a part of an ecosystem. You know, we work upstream and we work downstream. In terms of upstream, we have created pathways for people in 7 zip codes in our city of Boston to living wage paying jobs inside Boston Medical Center. And once they get in, they don't just stay where they are. You know, we have programs in our Human Resources Department that enables them to go through professional development, go from entry-level jobs up to managerial jobs, and we are creating pathways also for director jobs, for example. We also have recently started an opportunity for patients to do the same. We screen patients for things they don't have, things they're interested in, opportunities they want, with education and employment being one of them. And, you know, we now have opened up that opportunity for our patients, you know, to go through education and have access to jobs. The other thing you actually heard about already from Ismail Samad. I wish I had been able to hear him, but I was en route to hear. But investing as part of the ecosystem in small businesses. And it was very, very interesting. You know, when we invested in that market, I will say that it was a different market when we first invested in it. It was built out by some, previous owners, but the store didn't open because of the pandemic. And they said they'd identify us 2 local operators, and one was Ismail. But they had no interest in being operators with the experience they have and the knowledge they have, because they wanted to own the business and the physical space, which makes complete sense, because then they would, contribute to building generational wealth for themselves, their employees, and they know, and including the entire supply chain. Everything they do is focusing on root cause and upstream and enabling people to be able to thrive and, have generational wealth. The other things we have, we had the first hospital-based prescription food pantry, and doctors can write prescriptions for patients, but these patients are also screened, for education, employment, and that type of thing. Actually, Tufts did a study on that pantry at one point. One of the questions they asked the patients is, what would it take for you to not need this pantry? And they said they couldn't imagine it. And what I will say about that is, it says a lot about us. You're not being intentional and thinking about what the root cause is, and coming up with pathways for people to have opportunities to not need that. Because it's not the decision path we make for ourselves or our families or our friends' kids and things when they don't have things. We put them on paths to have self-determination, but for others, we send them to subsidies that are not designed for people to someday not need them. So those are some of the things we have. And the last thing is we have a rooftop garden. Kids come there and, they learn to farm, and we also use that food for our patients and our employees in the cafeteria.
A lot going on there, a lot. Thank you. And we'll get back to some of the policies, I think, in what both of you are doing, but I do want to make sure that we leave time to hear from Zoe and Concetta. Zoe Simmons, you're a member of the Food is Medicine Massachusetts Coalition, and I wonder if you want to talk with folks about your experience with medically tailored meals.
Well, I think what I'd like to say is it's hard. You asked me what would I do? I wouldn't be a survivor of Me Too from my family. I wouldn't be embarrassed.
It's okay.
And I wouldn't be publicly here, no, I would, publicly here telling everybody, because I'm on video and I'm going to be on YouTube. And I can tell you why that's unusual, because I've also been a caregiver of my parents. I had to, because my family was so awful, I had to disown them. They're missing out. And do the right thing, take care of my parents. I have health issues that started that a little bit. I'm allergic to shrimp, scallops, crabs, things like that, and gluten and certain medications. And I had a bunch of seizures. My first seizure, for those local, I landed at the feet of Speaker Tom Finneran. Second one, I fell at the Worcester Centrum down the stairs. I had had a lot of shrimp the night before, and I had a few muffins for breakfast. And poor Governor Deval Patrick was about to take his acceptance speech as the gubernatorial candidate, C-SPAN, CNN, historical, and I fell down the stairs, had a seizure. He had to pause. I did collect myself years later. My first name is Antigone. My middle name is Zoe. My last name is Simmons. And you can call me Tig, because this is what's happened here. I was Antigone, and I told my truth on Facebook because I was so scared. I was so alone during COVID with just my dad. I figured if I caught COVID, I'd die and nobody would know. But you folks, the work that you all do, I'm happy to say the open pantry in Gloucester has pretty much saved my family and my life. I took care of my mom. She had cancer. She was my favorite person, my soulmate. Everybody, I hope you have someone like that in your life. And she died right before COVID, and my family was even more horrible. So anyway, the point is that then COVID came. My dad had had strokes, dementia, other issues. He was an alcoholic, and he was not a good person, but he promised to do penance after my mom died. And he did. But he just died a couple months ago. And so what I'd like to tell folks is the last pretty much tidbits is I'm a lawyer. So if you want to talk about education and training, this can happen to anyone. And it's hard to say because my career name is Antigone. But when I was trying to hide from my awful family and people, I'm shaking. I see my hand shaking.
It's okay. It's okay.
I had to tell, I changed my Facebook page to Zoe, which is my middle name. My mom did well. First name, tragedy. Middle name means new life. And so people didn't know. And last week when I called, I didn't know what this panel was. I had no idea. And I'm going to segue back to, I was getting food from the food pantry, and somebody had something, oh my God, gluten-free food. It's so expensive, it's so expensive. And then I forget the lady's name. She said, oh, there's a program at the pantry here, and I have a flyer. It's all about the flyer, ladies and gentlemen. A very simple, straightforward flyer. But the problem when I was living with my parents, taking care of my parents, and what people all talk about is programs for children, programs for school. I can tell you that my alcoholic father, we were on welfare. I didn't know that the morning breakfasts weren't everybody's, just so you know, at school. Where was I?
No, you were talking about the pantry.
Oh, okay. Sorry, I'm not good at this.
That's okay. You're doing fine.
And so I contacted them. And what's wrong with a lot of this is to get SNAP, to get other programs. And no disrespect to anyone, but you've really got to be poor. I got a part-time job to try and get out of the house, to like do something and use my brain. And I work at the tractor supply store, and people bring in their dogs or cats, and I have a kick of a time. And now it was difficult to figure out how I was going to get the program because of the money. And like SNAP, it's had a household, it's a whole combination. But now it's just me. And as me, I'm going to maybe apply for SNAP, but it's awful to think that people are so embarrassed, shamed, and all such things. And professionally, I've now today realized how brave I am, because my whole career could be ruined. But if anybody knows a job, I need one. And as you can tell with my political background, I know every single one of the people who represent our delegation. I was the chair of the Democratic Party in the city of Haverhill, 60,000 people when I was in law school. I've been off the grid. And now to try and explain why is happening right here and now. So I'm taking a lot of time, but the flyer is important, making sure that all you academics and professionals with such big hearts know how to communicate to the people who are receiving. You'll notice my voice just changed. The advocate in me says, we can do better. From the standpoint of, this is like undercover boss, right? I've been there, now how do I tell you? And I'm now going to pass this off to my next person, because I don't know how long I should be.
She has a mic. Concetta Paul, you're next, and you are also, thank you. Very good, very good. Concetta Paul is also a member of the Community Advisory Board for Food is Medicine, Massachusetts, and she can talk a little bit about her experience as well.
So thank you. Yes, my name is Concetta Paul, and thanks to the organizers for inviting me to this panel. So I also, like Zoe, received home-delivered meals in 2021. That was after a car hit me on a crosswalk right outside of Tufts, and I ended up in this hospital. I dislocated right ankle bone. It burst through my skin. I spent months in a knee-to-ankle splint. I had to use a walker and stay off my feet, so I couldn't cook. And because I live alone, I had no other option for meals. So I had never needed those services before. I knew they were available, but I did not know how to access them. So I went online and I searched frantically, and I eventually stumbled on community servings. Now, back then, there was no website, but now we do have a Food is Medicine Massachusetts website. So as a beneficiary of home-delivered meals, I can attest to their usefulness and their dependability. I was especially grateful for the ethnic component, and it was referenced earlier from the Nubian representative, because those ethnic dishes reflected my own food preferences and cooking style. So I found an old ancient Chinese quote which says, "Our actions become our habits. Our habits become character, character becomes destiny." So if we want to change our eating and nutritional habits, we must begin by changing what we think about nutrition and the crucial role it can and should play in our lives and the overall life and health of the nation.
Very good, very good. So I wonder, a lot of the work that we've heard about, a lot of what we've heard from Concetta and Zoe, I wonder, what do we do to make sure that it is more widely known to people, that there isn't stigma around getting these kinds of services, and that nonprofits in particular can join together so they're not siloed and they can offer services to the greatest amount of people. Would you say that's one of the biggest challenges, or how would you describe it?
Well, first of all, listening to Tig and Concetta, life is hard and it's complicated, and our health is complicated. And it's rare that, at least for community servings clients, that they have just one illness or just one social determinant or just one barrier. It's many things. And we have to meet them where they're at if we're going to really help them. I think that, like the great speaker from Farmbox RX in earlier panel, I think this is going to happen in the next, she said 3 to 5 years. I was going to say 5. I think from a policy perspective, it's what do we do when it happens? Because there aren't the services in Massachusetts is way out in front of many states. And kudos to us and our progressive public health and administrative leaders. But what are we going to do? So I think it starts with food justice organizations, unfortunately, have to look more like healthcare in order to work with healthcare. So we spent a lot of time and a lot of money invested in HIPAA and data security. We think a lot about scaling. We co-lead the National Food is Medicine MTM Accelerator to scale and incubate new programs around the country. And we're on the cusp of developing an accreditation program that will accredit medically tailored meal programs all around the country. So somebody like Pam at Kaiser Permanente knows that if Kaiser's buying medically tailored meals in California and Colorado or Pennsylvania, they know that they're going to get the same intervention. And so starting to think like healthcare. And as a former restaurateur and food justice person, that's anathema to me. But that's how we got to go. And so really thinking about the operations of how do we, once we achieve the policy, how do we make it actually happen? And I think that's going to be all of our legacy.
Thea, James, what would you say about that? And what do nonprofits need to be successful?
I think in our sector, in the healthcare system, I think, we have to transform the way we think and the way that we act. Most often we tend to go in rooms and talk about what we're going to do, create solutions for what people need. I think we need to start with people and allow them to inform us about, what they need and actually allow them to partner with us and participate in what the solutions are. And in terms of, I would say, government, I'm incredibly proud of Massachusetts and, as David said, how far out front we are and how we lead in many different ways. But I also think that we too, government as well, could help with asking communities, asking the people themselves, and enabling them to invest some of the resources in a different way. In a way that people define best suits them, whether they are people who are in need of something or people who are just in need of economics, some sort of economic stability. So I think it's a collaborative effort. And again, for a health sector, we need to step outside of our own walls and, let people collaborate with us.
Mm-hmm. Concetta, I know that you wanted to.
Can I piggyback on what she said?
Mm-hmm.
Because I think most of us may have heard last week there was a report that said that a full-time worker in Boston must earn $51 an hour just to be able to rent a 2-bedroom apartment in Boston. But understand that the minimum wage in Massachusetts among the highest is still $15 an hour. So the apartment rents, a median rent for a 2-bedroom apartment according to Zillow is $3,200. And so this minimum wage worker is grossing $28,000 and the apartment is costing $24,000. So at the end of the year, you only have $4,000. So no wonder the report says that people have to sacrifice things like food because you're paying for your apartment you cannot afford, so you don't want to be homeless, so you hold on to the apartment, but you sacrifice food. So one of the things I'd like to see is that maybe one of the interventions can be nutritionally, I worded it? Nutritionally tailored meals. We have medically tailored meals for people who have medical, people who are sick. But we can have nutritionally tailored meals for people who cannot afford to eat nutritionally, people who are working full-time. The infrastructure is already there, and I think, maybe with the Biden administration, Tufts, Friedman, they can form a partnership. Maybe you could have a pilot and test it, because you had, during COVID, you had free meals as well, and it worked. So see whether you can test a similar pilot where you produce nutritionally tailored meals for the working poor, the people who are working minimum wage, and because they live in high wage areas and rent, have nothing left to live on.
Well, quickly. Zoe wants to add something, just a couple seconds.
I'm not good at short yet. I'm Greek, it's never going to happen.
It's okay.
Two things. The goal would be, as I read on the food tank website, the largest population of 50 to 64-year-olds are the most in need of services such as this, and that if that's me, if you can't tell, and it would seem to be growing, and that would also be the same people that are caregivers, and the caregiver segment is missed. And then I'm on a happy note. Something that also I am concerned about is, how do I transition? I'm looking for a full-time job. What do I do now? I haven't been to a supermarket in a long time. I don't know how to meal plan. I don't know how to budget. I learned a bit in the Food is Medicine program. I love Robin Stone. But I don't know what to do. And I know on Mass Health, before COVID, I couldn't do, nutritionist was a new thing, and then I couldn't do it on Zoom. And now I'm not going to have a nutritionist. I mean, I don't know. I'm going to need help. And that's a program that I think is one of the best, because it can happen too.
Education will
I
help
hope it does. I'm working on it. No, it's going to happen. Anybody, I could use some help, like on all levels.
Okay.
Thank you.
All right. Thank you. Thank you all so much. Thank you really for being brave and sharing your stories. Thank you for your insights. Thank you.
To all of our panelists. What a powerful conversation. And I want to thank all of them for being vulnerable and for sharing their viewpoints in such a powerful way.